Thank you, Mr. Speaker. Today is a day of joy, and it was indeed a long time coming, but here we are. My time in Congress was redefined 4 years ago on December 14, 2012, when 26 innocent lives were taken at Sandy Hook Elementary School in Newtown, Connecticut. Now, that's not my district nor my state, but when it comes to children, all of us represent all children. Afterwards, when I met with the families, they gave me pictures of their children and spouses who they lost that day, and I made a promise. The promise that we would not continue to watch passively nor just offer moments of silence as these tragedies continue. That we should deliver instead treatment before tragedy. Today, Mr. Speaker, I'd like to say thanks to the members of Congress who changed the course with me, who teamed up to fundamentally change the way the United States treats the mentally ill. We set our eyes on one goal, to fix our nation's broken mental health system, and since then we've come together to work towards protecting millions of Americans who suffer from mental illness. We traveled to every corner of this nation, listening to doctors, psychologists, and psychiatrists, experts and advocates, and most importantly, patients, consumers, and their families. Through congressional hearings and investigations, we discovered the abhorrent and its sometimes fatal disconnect between the 112 federal agencies who are assigned to treat the mentally ill. We exposed $130 billion spending in a system that has done little but watch the rates of homelessness, incarceration, suicide, and drug overdose deaths soar. We came together across party lines and went to work. We passed legislation that will save lives. I want to thank Fred Upton for his leadership in Committee Energy and Commerce on H.R. 2646, the Helping Families and Mental Health Crisis Act, and for his tremendous medical innovation bill, the 21st Century Cures Act. I thank Eddie Bernice Johnson of Texas for her conviction and determination in applying her experience as a psychiatric nurse to champion the cause that someone in crisis should be able to get treatment in a hospital, not just locked up in a jail cell. And I thank Speaker Ryan, who in his very first days as Speaker of the House pledged his support and determination to ensure that we would take action in the way that we treat the mentally ill in this nation. And to all my colleagues in the House who spoke up, stepped up, and teamed up with our efforts to end the mental health crisis in America, thank you. I thank our colleagues in the Senate as well, Senator Chris Murphy, Dr. Bill Cassidy, and Senators Cornyn and Alexander for their leadership to bring this bill to a vote before the Senate. As the Senate takes up the bill today, I ask them all to cast their vote mindful of the millions of Americans' lives it will save. And most importantly, I close thanking the millions who had the courage to come forward and share their stories of pain and suffering under this broken system. Those who have lost a loved one, those who have a loved one sitting in a jail cell or homeless in the streets. To those who have been the last, the least, the lost, and the lonely, know that we will continue to listen. In the final version of the Helping Families and Mental Health Crisis Act, we did not get everything we needed, but we needed everything we got. And we will continue to work together. When we began this journey 4 years ago, I challenged us all to realize the sad reality of where there is no help, there is no hope. Know now that as we pass and enact this bill, we will finally be able to say, there is help, and most assuredly, there is hope. I yield back.